Okay, Joe. Thank you for allowing us to just talk with you about this. I'm just going to summarize a little bit and then just get your comments so maybe you can help other people and dentists that are debating whether they should do our program. You started here with periodontal disease, and we took blood test, and your C-reactive protein was 5.2 milligrams per liter, which is, in the high cardiovascular risk range. We straightened out your gum disease. Basically, all the bleeding was done, and in 8 weeks later, your C-reactive protein, when we redid the test, was 13.3. So I had advised you to talk with your physician about that because there's a possibility that there's an underlying medical condition. So can you tell me what was the first medical condition that they found after we did these?
The first medical
And talk loud.
the medical condition initially was gout, which I had forgot to mention up front. And initially, when the reading was high on the CRP, was contributed to gout, which I took the proper medication for.
Good.
And had gotten the uric acid level down to a very low amount. However, the CRP still did not respond on it.
So the CRP was high, even though you solved the periodontal problem and the gout problem. So you went looking for some more.
Well, then I started thinking. I said, okay, the doctor dentist had advised me to talk to my physician about possible other things, and the doctor that I talked to had advised me there's other things that you should have done at your age, and one of which is the colon inspection. And initially I procrastinated on it, but because of the visit to the dentist, I said, you got high rating on this CRP, it motivated me to say, okay, I'm not going to carry this. You should get a colon inspection around my pocket for 6 or 8 months. I'm going to pick up a phone and have it done.
So it kind of pushed you to go forward and find out what's going on.
It motivated me to go ahead and get it done because it has a much higher impact. Here's a person who just came from the book, there's something else wrong. And so that coupled with the doctor's suggestion, that you at your age get this done. So I had it done. Unfortunately, it was a early cancer dose.
It was colon cancer.
Colon cancer.
Okay, and what was the stage of colon cancer when they removed?
There was one polyp that they removed. Polyp itself seemed to appear to be all right on the lab report, but inside the thing was a small amount of a small section that was early cancer.
It was early cancer. So all this started, at the dentist, which is, a little unusual. Gout and colon cancer kind of pushed at the dentist. But, if we didn't have these ranges that went high, you barely wouldn't have known. I mean, maybe you wouldn't have gone for the gout.
Well, the gout, yes, I had gout for many years, but it's like everything else that the gout will flare up on you, and then say, oh my God, I'm going to run to a doctor, but then it subsides.
Yeah.
By itself, and then it gets, oh, okay, I'm all right again.
Good. Do you think that if dentists tested the patients that had gum disease for diabetes or high cholesterol or high CRP, do you think that might be valuable to people to get them healthier?
Yes, I really do, because most of us see our dentist probably twice a year. We may not see a doctor more than 4 or 5 times, or once in 4 or 5 years. The majority of the time we go to the doctor is when something is hurting us.
Yeah.
That's the only time we really think about that. That's not true with the dentist. You go to a dentist where you're clean and to keep in preventative dentist work. So I think it's a natural. First of all, it's a doctor. Each dentist is a doctor too, and they understand a lot of things. So they have you there, and with, I think, upfront tests available to the dentist. given to the patients could be a tremendous help for the health of the people.
And when you were telling me that you were talking to your friends about our office, how do you view our office? Like a regular dental office, or what did you describe to your friends about this office?
No, the office itself, of course, is very, very nice, but that is true with many, many dentists. The things that my wife and my people I talked to recently, we all were had a get together, was the testing that their dentist does, and the answer to that is virtually nothing. They obviously clean your teeth. They obviously take a cursory look at your gums and detect bleeding there. Normally, that's to check for gingivitis or things of that nature. When I had mentioned the dentist I go to test, gives you blood tests for 3 or 4 different things, give you solutions to put in your mouth to help with early cancer detection of the membranes in the mouth area.
In other words, our oral detection of cancer.
Yeah,
You thought that was impressive
it
too.
was all these other tests, and the other ones all had the same conduct. Just about my dentist doesn't do that.
Yeah.
And well, I'm glad mine does.
Well, thank you so much. And you said that you look at us more like oral physicians instead of just a regular dentist.
Very much so.
Yeah.
For you, I believe.
I appreciate that. Thank you. And any last comments that you want to tell the doctors or anything?
Only to kind of help the push and the drive for dentists to participate, helping them as well, and helping the patient by giving these tests when they come in addition for their normal dental work.
Great. And do we have your permission to use this for our educational purposes in our program?
Yes, Bill.
Thank you. And then one last question. Our program that got rid of your periodontal disease, did you find that program to be pretty easy to follow?
Yes, it's not that hard. It's like everything else. Does it take that many hours to brush your teeth? No, of course not.
Right.
It's not only brushing teeth, doing it right, getting the necessary brushes, and we'll fix that they'll give you to make sure that the debris in clotting between the teeth is addressed. But the majority of it is basically what time you are spending now.
Yeah.
5 minutes, make it 8 minutes.
Yep.
And that's about it.
Yeah. The double brushing, the mouthwash, toothpaste, toothpicks, nutraceuticals, right. That system. Now, you've been around the block a little while. Has anybody ever talked to you about this program ever in your checkups before with all the other dentists that you've had through your life?
No, none whatsoever.
Do you think you could have avoided a lot of dental work if you had this program maybe some 30, 40, 50 years ago?
I certainly would have had a lot more peace of mind because I knew somebody was watching.
Yeah.
Yes, a lot of the dental work, unfortunately, the damage was done earlier in life. And depression baby, no one had any money.
Yeah.
And a lot of the initial damage was there for, but since as an adult, I certainly have tried harder on keeping the peace there.
Great. Thank you so much, and we appreciate that.